Today on Experts from Denture Artistry, Implants, Crowns, Veneers, Dr. Tom Spoonster is my guest. Tom, how are you?
Good, Frank. How are you doing?
Doing well, doing well. You guys have really good experience and have done a lot of things with patients in this area regarding making sure that even though a tooth has to come out, that it's still, their smile, their mouth still looks pretty much the same. And you've accomplished that in a couple of different ways.
Right, yeah. So one of the main things that we like to tell our patients is that whenever, say, in the event that you need to have a tooth removed, once a tooth is gone, the bone's never going to be quite the same. So we want to try to keep that bone from shrinking away as much as we can. So most cases we do recommend doing some type of socket preservation in order to keep the bone that you have there. That just gives you a lot more options for what you can do afterwards as far as getting implants, making sure there's enough bone there, or even just making sure a bridge or something like that is going to look a lot more natural.
Now, one of the things that you do, and I had done when I came in, it's been almost a year ago now, we had to have an extraction done, and planning for the future, maybe I'm going to want to put a bridge in there, maybe I'm going to want to put an implant in there or something. You did what's called a bone graft.
Correct. Yeah, and that's exactly the same thing as with when I'm saying socket preservation. When you remove a tooth, there is a void that's left there by the root that was in the bone. We fill that with the bone graft or bone particulates called that. The procedure is called socket preservation.
And when we say graft, we're not saying that he's going to go get it from you somewhere else and put it in it.
Correct.
This is highly compatible, already purified. It comes in a little jar, and they put
exactly,
it in there.
Exactly. We do like to utilize what's called a platelet-rich fibrin, which we do draw some blood in order to mix that in with that particulate. But that
that's
helps
an optional
with the healing
thing, though.
Correct. It's not 100% necessary. It does help out a lot.
So I didn't have that part done, but I did have the bone powder put in there, right. And it seems to be fine. I mean, we're not noticing any big holes over in my jaw there, right?
Right. Now, with any extraction, even with the socket preservation, you will get a little bit of resorption. In the back, really not a big deal. But one of the things I wanted to talk about today was something that we're utilizing for a lot more frequently now for front teeth, which we call partial extraction therapies.
That sounds like a good. Anything that's partial sounds good to me.
Yeah, not doing too much. Be as conservative as possible, right? And so what that is, one of the ones that I've been using a lot more frequently lately is called a root shield technique. So whenever you remove a tooth, even if you do the socket preservation in the front with the idea of placing an implant later in a front tooth, you're always going to have just a little bit of resorption of the bone and the gums. So even if everything's done really to the best that it can be done, you will still have a little bit of what we call like a black triangle typically next to that implant. And what that is if you look at your gums, the little pink triangle that comes in between each tooth, if the gums shrink back at all, you can actually see some space through it, and it appears black because the inside of the mouth is dark.
So what happens in a partial extraction?
So what we do there is instead of removing the entire root of the tooth, we can't do this in every occasion, but when we can, what we can do is just remove the part towards the roof of the mouth or towards the tongue side, leave a little bit of that root in the socket towards the cheek side, and that kind of fools the bone and the gums to think that there's still a tooth there, so they don't shrink back. So then once you have your final implant placed, it's going to look more natural than it would have had we not done that.
Just as secure as a regular implant, but now you've got the nice little pink fill-in. There's no noticeable effect whatsoever. Looks like your natural teeth.
Absolutely. It looks even more like you can't even tell something's been done.
That's really a cool thing, because I do have one of those black triangles in my smile, and this would be a terrific thing to be able to have. So Check this out. Go to Denture Artistry, Implants, Crowns, Veneers. How do they get a hold of you?
Best way is to check out our website, dentureartistry.com.
All right, dentureartistry.com. Dr. Tom Spoonster, thanks for being here today.
Thanks so much for having me again, Frank.
All right, that's Dr. Tom Spoonster, Denture Artistry, Implants, Crowns, Veneers. It's dentureartistry.com.